I'd like to introduce you to our mentor or the moderator of our article today, our beautiful Asmahan Saleh Khalil. She is an amazing BCBA that agreed to volunteer her precious time. And I know how time is so precious as BCBAs. So I would like to thank her from the bottom of our hearts, from the ABA Journal Club group to Asmahan in accepting this invitation. And
My pleasure,
I'm so
completely. Thank
excited to
you
know about
for
your
this.
topic. Sorry?
I'm saying it's completely my pleasure, and thank you for that opportunity.
Absolutely. And so I would like to go ahead and start before going into this. This is an overview. Thanks for going to the next slide. This is an overview of what we want to do. Sorry, can we go back, Asmahan? Yeah, just right here, just the overview. So we'd like to quickly give an introduction of ABA Journal Club, and then we'll talk about the summary of the article that was chosen. And we'll go through the different topics of the article, and then we'll talk about the 7 dimensions of ABA. As you got used to that kind of. At the end, we discuss about the 7 dimensions of ABA, and if the article has met the 7 dimensions of ABA. So always keep the 7 dimensions in mind when reading any article, and that was the whole purpose of the ABA Journal Club. We read, we discuss, and we enrich our minds in order for us to apply those evidence-based practices in our work. So let's go ahead with intro to the ABA Journal Club. Okay, so as you know, it's a volunteer-based, it's non-profit initiative. It's created or founded by 3 Emirati BCBAs, myself, Manal Aryani, and Nusayb Al-Amri. Thanks to them for putting this together and, helping us to disseminate the knowledge of APA in the correct way using evidence-based practices. And when we say evidence-based practices, that's what we want everyone to practice, is to go into those articles, into those journals, and get those evidence-based practices in your practice. Yeah, so make sure if you are open to be a member of the ABA, of course, ABA Journal Club, it's of course free. It's, very casual. We do this in a quarterly basis. So every 3 months, we kind of get together and discuss an article and see how it could be applicable in your setting. We present the articles, we earn free CEUs thanks to ECAE, and we try to reach as wider audience as possible, even if they're not in the ABA field, but it would be great to kind of utilize those articles. And of course, this is our email, the ABA Journal Club @gmail.com, and there will be a link posted. I don't know if Michelle can help us with that, just the registration link for becoming a member of the ABA Journal Club, or you can just shoot us an email, the ABA Journal Club @gmail.com. And of course, I can't even thank ECE enough for collaborating with us in order to give you guys the CEUs that you need to collect for BCBAs. As you know, it's 32 CEUs. 4 of them are ethics, 3 of them is under supervision, and then try to get it before your expiration date. All right, great. Don't forget to follow us on Instagram. That's our Instagram link, ABA Journal _club. And you can find our previous sessions on YouTube. Thanks to ECE for recording this and editing it and putting it in our YouTube channel. So feel free to go into the ECE YouTube channel to look for those the links. All right, so now it's time for Asmahan to take the floor.
Thank you, Sharifa. Thank you for introducing this wonderful club. I was so happy to see that you're putting all of this together, and I really appreciate the effort, and I love to see the dissemination of ABA in such a scientific manner, really talking about these articles. I remember when I first started in the field 10 years ago, it was a challenge for me to go through them. It was a little bit lonely to really get into the research. So it's very helpful to have a support team, or at least these meetings to keep the conversations going. So thank you for that. The article that I chose, it's called Visual Supports at Home in the Community for Individuals with Autism Spectrum Disorder. So what it is, it's a scoping review. It's not a systematic literature review. You cannot see the slides. Someone said that they cannot see the slides.
I can see the slides fine, Asma. Can someone else confirm if they can see them?
I can see them too.
Thank you, Sharifa. Christine, what I recommend for you, Christine, is if you leave the session and rejoin, that usually fixes that issue. Thank you. Sorry, Asma.
Of course. Yes. So maybe if I'm gonna start with just an introduction of myself. My name is Asmahan Saleh. I am a board certified behavior analyst. I got certified in 2016. I have been in the field for 10 years now. And starting last year, I started my PhD with Queen's University Belfast. The thesis of my PhD is autism, adolescence, and sexual health education in the Middle East, trying to really make that aspect of our programs as culturally appropriate as possible. And in my intervention, in my research, I do rely a lot on visual supports. So this is why I thought this article is very relevant, because of the effectiveness that it has. And also, we'll talk a little bit more about some of the things that I think we can all agree on, which have led to really the importance of this article and the reason why I chose it. So I think visual supports in general is one of the go-to methods that a lot of behavioral therapists, a lot of therapists in general, they use to support learners with autism or other intellectual developmental disabilities. So I think we can all agree on their importance, and they're large evidence base. Another thing that I'm assuming we can all agree on is the importance of the role of parents in the validity of interventions. As much as we see improvement, as much as we see change, effective behavioral change in our students, if that change is not generalized to the home setting or to the community setting, can we really say that it has been effective? So the importance of the role of parents is something that I think we can all agree on. A third point that I think we can also agree on is that parents, more often than not, do not come from the background of behavioral therapy. They come from different backgrounds, they come from different educational backgrounds, they come from different understandings, and they really do need that support in applying the strategies that we as therapists probably are very used to. We have done it several times. We have worked with different families on visual supports, but each family separately is not as experienced as we all are. So combining these three factors together, this article really talks about bridging the use of visual supports between the school setting, or the clinic setting, and the home and community. It talks about the importance of it in terms of how parents perceive that intervention and how effective it has been. Now, again, it's a scoping review. It's not a systematic literature review, which as a researcher, I've been doing research for a year now, I've come to realize the importance of scoping reviews, because even though they're not as systematic, as in-depth as systematic literature reviews, they do provide a general background information about what does exist and the definitions of what do we mean when we say visual supports, and what do we mean when we say visual supports at home, what exists out there, before going into a really very qualitative assessment of the research. So it was a quick scoping review. That is the first verification code, green, for those who are seeking CEUs. The introduction section of this article tries to define what are visual supports. they do mention that they did not find a specific definition of what it means, but they have combined different terms and different definitions and put together a list of what we mean. What we mean is that something that is seen or held that provides visual information which enhances an individual's understanding of his or her environment. So we're taking an abstract concept and we're making it concrete by a method that's either seen or held. It supports expression. It can come as a visual alone, or sometimes it comes as a supplement to spoken or written word. It is a tool that's designed to help acquire many other skills. So this really brought back another term that you might be familiar with, behavioral cusps. There's a very important article by Bosch and Fuqua in 2001, I believe. I'd love to share it. But what it does is that it gives seven or six different dimensions to what is a behavioral cusp. And visual support really fits in all of these requirements. So when we call it a cusp, we mean that it really opens up the doors to other skills. When you teach it, you're not limiting it to one specific skill that you can do very little with afterwards. You teach the use of visual supports, you open up the door to many other skills that can come, and we will talk a little bit more about that. But it does fit in the criteria of a behavioral cusp. It is very common. I'm sure all of you, if not most of you, if not all of you, have some experience using visual supports, and it's recommended across the lifespan from when a child is a toddler up until adulthood. But there is still an issue there, which is what we're going to talk about, that bridge between the school or the clinic setting and the home and the community. PECS is not included as an example of this because PECS is very manualized. So for PECS, it already includes in the manual of PECS how to include parents, how to generalize it to the community. It's part of the steps of PECS. So they specify that they're not talking about PECS. They're talking about all other visual supports, which we will give some examples of. Some examples actually are task analysis, visual task analysis, labels for different items. So when you label something as toxic and you put that toxic sign, wet floor label, for example, male-female restroom label, schedules, visual schedules that can be like an activity schedule, a specific one, so what we're going to do within this session, or it can be a day schedule or a month schedule. These are all included in visual supports. Timers can be visual timers. If I say 5 minutes with a little visual support of 5 minutes right here, it's different than me just saying 5 minutes for someone that's not that familiar with the concept of time, and other aids. I would love to know what you're all using. If there's, I'm going to give some more examples, but would love to hear from you. Thank you, Dr. Kelly, for that question. Just some suggestions for what visual supports you've used. So basically, what this article is trying to do, the methodology that it follows, ultimately, they want to come up with recommendations for practice of visual support in the home and community setting. And in order to do that, what they did is that they relied on 3 things. The first thing that they did is that they dove into the literature. They came up with 34 different articles. They specified, they limited these articles to those that include home and community settings, not those that were just in a clinic or in a school. So they dove into the literature, and from that they extracted the terminologies and the different types of studies that were done. Another thing that they did in this article is a survey for parents and professionals. They actually used 7 parents and 15 professionals, if I'm not mistaken, just to get out, to extract from that how much access they feel they have, how much access they've been given to applying visual supports, what is their experience, how they've been implementing it, what types of visual supports they're using. And the third thing that they did is that from this survey, they put together a focus group, which I think is extremely important. And the more I get into my research, the more I realize how focus groups are important, because it really gives you an in-depth analysis, an in-depth window into parents and professionals' experiences and views and barriers to implementing these visual supports. And a lot of suggestions came out from this article regarding how we can support parents and how we can create this bridge. Okay, so this is the methodology. They use 3 different aspects to really come up with concrete and valid recommendations for practice. First, then schedules. Yes, these are excellent. I'm actually giving some examples, some visual examples of all of these. Yes, activity schedules. And yeah. So there's 3 main research questions. The first one is, what are visual supports and how are they used? We talked a little bit about the definition. We gave the different factors for defining visual support. They talk a little bit more about how they're used, what type of evidence exists about visual supports and their use by families, specifically used by families, and what are the barriers for their use? How do parents feel and what's their experience? So these are the main 3 main questions that they talked about, and we will explore more. So regarding what they are, they were able to divide it into 4 uses for visual supports. The first one is something to understand the environment. So this is like the example that was given in the chat, first then schedules or activity schedules, that type of visual. The other one is rules and social cues. So this is where we have token boards. Oh, sorry. Sorry, I lost my... Can you still see the slides?
No, it's not visible.
Sorry, because I lost control. I'm bringing it. Okay, sorry, it's coming back. I'm not sure what happened. Okay. Okay, so so understanding the environment, rules and social cues. So here we have different uses for token boards for how we behave in a classroom, for example, how we behave at home, how we behave in the community. When we go, for example, to the park, we need to wash our hands. We need to make sure we don't, I don't know, we stand in line properly, we go up the slide. So different visual supports for rules. Communicating is one of the ways that visual supports are used, and consistency across environments. So this is, for example, some schools, they use a home school communication system that includes visuals that is either filled out by the student himself or by the teacher, and then vice versa, communicating between home and school. It's one of these examples. I provide more visuals here, so that's visual support for my presentation. The first one is just an example of using AAC. Break time choices is the second one from up. So different choices for what can you do during breaks, male-female restrooms, visual timers. The big one in the middle is just basically different rules for how to behave when you're getting on the bus. The last one on the right is a visual timer, also to kind of help the student tell time. This is another example of a task analysis that was done with one of the schools I was working with. So basic task analysis of washing the dishes. This is another example here. I used Sharifa's wonderful app that I really use often, Tokenat. So Tokenat is another visual support for tokens, or for really the effort that the child is putting, for rules before I talk, what you need to do, the steps. And then the last one is an example of what I was saying regarding the homeschool communication. So visuals can really be applied across different environments, for different types of learners, for different ages and different abilities. The second question, what type of evidence exists Yes, that's the link. Thank you for providing the link. It's a wonderful app. It's really can be used for different learners and provides that extra visual support. I only see the previous slide. I just moved on to article summary. Is that okay? Everything's good?
Yeah, Asma, I can see the article summary slide. Sometimes, Mohammed, just on the top left of your screen, there's a button that you can press to make sure that you're seeing the view of the presenter. Thanks.
Okay. So regarding what type of evidence exists about visual supports and how families are using it, so they have seen through the literature review that there is an improved on-task behavior as reported by parents. It has lowered anxiety, so I'm sure we can all imagine how having a visual timer would lower anxiety, for example, for delay tolerance versus just saying wait 5 minutes or wait 10 minutes. They have reported increased independence in different tasks. So, for example, for that task analysis for washing dishes that I have presented, you can assume how it would increase the independence. Instead of having someone sit there and repeat all the steps and repeat all the rules or tell you what to do, you're more independent in washing the dishes when you use that visual. Improved parent-child interactions. That can be across different types of visual supports, but this is what parents reported in the literature. The questionnaire also contributed to this question. These are the significant results that came out of it. 23 out of 71 professionals said that they received specific training about implementing visual supports in the home, which, my opinion here, is very little, because considering the importance of visual schedules and considering these factors and how important they are to families, I think this number deserves to be a little bit higher, so professionals can really know how to support parents in that. 90% of those that said we did not receive said that they would need it and they felt that they would need it. 11 out of 30 reported insufficient training. 26.7% said they stopped because it was no longer needed. And we will talk a little bit more about that. But even in the article, they question what it means to no longer need visual support. The other 26.7% said they stopped because it was too hard to manage, which makes sense considering the lack of training. 60% said they stopped because it did not work, which also is a little bit of a question mark since we already know the evidence base behind it and how it has improved the lives of different learners. So when 60% of parents say that they stopped because it wasn't working, it gets us as professionals to wonder what's the missing link here. Is there any questions so far? Is this making sense? Would you like to share the training that you've received for visual support and specifically for being able to support parents in that? Yes, so thank you for that question. Is it self-taught? I mean, this is exactly what this article is trying to come up with. They're going to come up with recommendations for what parents need. So us as professionals would make sure that we are providing it. So this is something that we might know. We know how to implement visual supports. We know how to implement a task analysis and how to turn it into a visual task analysis. But are we really transmitting that knowledge to the parents? So this is specifically the importance of this article. Muna saying in my grad school, I got trained on different visual supports. Excellent, Muna. So, I mean, this is a pretty common, and again, we use it a lot and we've mastered that skill. It's just really transmitting it to the parents. And this leads us to the third aspect of this article, the third research question, which is what are the barriers? Okay, so we know that they're important. We know that parents are struggling with the implementation. Why are they struggling with the implementation of something that is so important? The first reason that they've reported is limited access. And that really is, I mean, for parents and for professionals as well, we might know and we might share together different resources for these visuals. I have a list. If someone is interested, maybe you can email me, and I'm sure we can share some in the chat of different resources for finding visuals. But do parents actually have access to that, or are they getting access to that? Are we communicating that enough? Are we providing them with really kind of like a support system or open access or easy access to that. The time required to make and learn, I think this is something that we can all agree on, because even for us as professionals, with the access that we have and with the resources and with the different groups that we are a part of, it still takes us some time to really make these visuals and get them together. That is why I more often than not suggest things that are on tablets and on screens, because they're easier for parents to do. But for some students, that's not effective, and that's fine. Some students, get really distracted by the tablet or by the phone. So we go for actually printed visual support, which would take even more time. So that was one of the barriers. Limited support by professionals to the parents on the implementation of visual support. So this is also something they reported, that there's a gradual decrease that might happen. So we're thinning out the help too fast when we're talking to parents about that. Limited resources, of course, and limited support in implementing visual support. So let's say we're talking about a visual timer or a visual schedule, for example. So we tell the parents, this is what you need to do, A, B, C, D. They go off. We might follow up with 1 or 2 questions. Is it working? Do you need help? But according to parents, one of the barriers is that we're thinning out that help. We're thinning out these questions and this support too quickly. And they do need more support, especially that, as we said, visual supports being behavioral cusps, really they provide access to so many different environments, and we need to make sure that parents are able to. So if they're using a visual schedule at home, are they using it when they go out to a restaurant? Are they using it when they go out to the park? Are they using it in family events? If we have a visual support in the classroom for quiet hands and all of these other rules, are they able to use it when they go out to a public place where they also need to use quiet hands, or they need to have any other kind of social cues available? Are parents able to implement it where it is very important? So a behavioral cusp is basically research for activity schedules. I'd love to share the article that I mentioned that really dives into it. But it's basically a behavior that we are teaching that is valid beyond what is taught. So for example, you're teaching reading, and then you can start by teaching different letters and the sounds of different letters. That would lead you to teaching a word, which would open up the doors for the child learning to read books and magazines and newspapers. And so it's not just the act of reading a specific word, it really provides access. So you're teaching a child to open the door, you're teaching it in the classroom, but it also allows access to opening so many different doors, to entering different places. You're teaching a child to walk, it provides access to walking different places, helps you teach running, helps you teach skipping. So really a behavioral cusp. I would love to talk a little bit more about that if we have time towards the end, and maybe go through the different aspects of a behavioral cusp. Another barrier that was reported for the use of visual support by parents is consistency. So how consistent is it with them and with the professionals that are implementing it? Yes, exactly. Exactly. Yes, thank you, Sarah, for sharing the article. I'm not sure if this is the one that I was referring to, but I'm sure it would be helpful. So the focus group came up with different solutions, and I think we can come up with a lot of solutions together. Yes, exactly. That's the one that I was talking about. So the different solutions are having a bank of visual supports. And this, as I said, we might have different websites that provide these icons for putting together that visual support. But when it comes to a specific bank, I really believe in, please let me know what you think, but it needs to be individualized. And this is a recurring topic that came up from the focus groups, the importance of individualization for that bank of visual supports, because you have different learners. You have learners that are using actual pictures. You have learners that are using icons. You have learners that are using, just different words that are written. So an individualized bank of visual supports that would help the parents get to it faster. Knowledge among professionals, which is what I'm hoping we can ignite through this webinar, talking to different professionals about what strategies they've used to support parents. access to make these visual supports. So whether it's something that's on a tablet, whether it's an easy app, so there are different ways that we can help with that access. Individualization to the child and to the environment. So professionals can also put together visual supports for the home setting, for the different places that this family. So if this is a family that specifically, if this is a child that does specific after-school activities, engages in specific sports, or has part of like a family routine that they engage in, then really individualizing it to that child and to the environment that they are a part of is a way that is one of the solutions that came up from the focus group. And maybe here we can talk about what else. So as professionals, maybe we can talk a little bit about, or if we have parents in this webinar, in this chat, what do you feel is the solution to really make visual supports accessible for you, and how are we using it? We will get after that into the 7 dimensions. So for example, I'm just going to share a little bit of my personal experience. My research, as I said, is focused on adolescents with autism and sexual health education programs. And I rely heavily on the use of visual schedules, of visual supports for teaching delay tolerance. So what we do is that we kind of go through a preference assessment, which would help the child really tolerate the delay that it would take him in order to get to an inappropriate setting for any kind of sexual behavior or puberty-related behavior. So I rely very much on parents, professionals, caretakers to know how to implement that visual support. And I would love to hear if any of you have any experience using that, have any experience using visual timers, for example, or schedules or other types of cues.
Actually, Asmahan, I did. Okay, in relation to that topic about, inappropriate public behaviors, we were able to show what is private and public places. So we used visual support to identify which areas are the public versus the private. Yeah, so this is one of the things. I mean, I can have many, many different examples, but I think just for me to share my experience in this, at least here in the Gulf region, families love the idea, but they find it a big response for them to implement it, to print it out, to laminate, to put it in Velcros, to, have those resources. Some families don't have these resources to buy printing and all of that stuff, so we were able to kind of try to help them out, create those for them, to minimize the effort for them. That helped some families that really their child needed that visual support. And I always tell the parents, and a lot of parents, they are scared that the visual support will minimize their language. I don't know how they came up with that idea. It's not even used as PECs. It's not even used as communication. Just the mere idea of having visuals. Yes. They have this false idea that, oh, it might affect their receptive language, or language الاستقبالية, so I don't know, what do you think about that? Thanks.
This is definitely that barrier of the response efforts it takes for parents to really put it together, which is why I mean, if we already know how effective it is, and if we're already able to prove it, whether it's in a school setting or in a clinical setting, that for one is encouraging for parents. And another one is this is what this article focused on, is that what role can we as professionals play in order to help them with that? So one of the things, I mean, Sharifa, as I'm sure you've seen with the development of your app, having it based on different tablets or different platforms would make it much faster, because you can take it everywhere with you. If we're relying on visual schedules on there, we can just take a picture, include it in the visual schedule, and teach the child to use it. But for those who prefer printed, then yes, it would take more effort. Maybe we as professionals can help them with that. Maybe we can have, as one of the solutions came up, a bank of pictures that are ready for use whenever they're needed. maybe some training on the parents in which we go through the evidence and we show them how effective it has been in the school setting with their child. Maybe that would also help. So usually if I feel that parents find it very hard, what I do is that I say, you know what, I will start and you'll take it from there, which helps. So once that behavior is mastered, then we can generalize it to the parents. It's easier than getting the parents to, it's easier for the parents to start it once they know that it has worked with their child. If anyone would like to share more of their experience, I would love to hear it. I'm going to go into the 7 dimensions. So these are the different 7 dimensions of ABA: generality, effectiveness, technological, applied, being conceptually systematic is very important. And I mean, this article talks a lot about that, analytic and behavioral. So here I just highlighted some keywords. Generality, I think this is evident for visual supports. Parents, they just need to learn how to bridge. So for us to ensure generalization, it's not for granted. It doesn't just happen seamlessly. It's something that we need to work on and we need to really focus on as professionals. It is basically a language. It expands over time. It is transferable across different environments and definitely across different behaviors. We just need to make sure that we are seeing it through. Effectiveness, it definitely does have a large evidence base for the effectiveness of visual support. I mean, just only for visual support, specifically in the home setting, there were 54, but then they narrowed it down to 34 articles. Imagine what that would look like if we're just talking about visual supports in general. So there is a large evidence base for that, but it does still need to be modified to fit individual needs. Technological, this is exactly what we need more of. We need it to be more technological for parents. So the same reason that they've excluded PECs, because it's manualized, then having a manualized strategy or maybe a specific training for parents that would help us transfer that skill or generalize that skill would be helpful. So that happens for PECs, and then we can see how that is easily generalizable for parents. Maybe we can do that for different types of visual supports to give clear guidance. Applied, I mean, definitely it can be applied to different types of behaviors. We just need to make sure that it is socially significant. Okay, it can be or it cannot be. It depends on what we make it. And because we're seeing visual supports as Cusp, we can really apply it to so many different skill acquisitions or skill deficits that we're working on, and it can grow with the child, and with as his abilities or her abilities grow, visual supports can grow with them. The second code is here. It's red. For those that are seeking CEUs.
Asma, can you just leave that there just for a moment, just for people to see? So this is your code. Please do not write it in the chat. Thank you, everyone.
Okay, I'm moving on. Is that fine?
Yes, perfect. Thank you so much, Asma.
Okay. Conceptually systematic. So as we said, there's a strong evidence base for visual supports, but considering the gap in generalization, there's an issue with how conceptually systematic it is. Can we say that it's conceptually systematic if parents are not a part of it? I mean, I wasn't so sure. This is a work in progress. This is where the bulk of our work needs to go in order to make sure that it is systematic and that it's easy for parents to learn and apply. Analytic.
Can I add something, Asmahan, for the conceptually systematic?
Of course.
So here when we say about this dimension, we want to make sure that our interventions are consistent with the principles of ABA, and so I think where this will come into place would be in our training. So if you want to train how to use visual support, so for example, I want to teach my child to learn the difference between private and public, right? Using visual support. That's where I think we really need to put our heads together with the parent to see what is the right way using the principles of the literature of ABA. So maybe discriminative stimuli, making sure that you are using discrimination, you're using positive reinforcement correctly, maybe generalizing it and using generalization, the different ways to generalize. So for example, implementing it with different pictures, the variety of pictures between public and private. What else? I'm just thinking out of at the top of my head, like something regarding the people that are applying, because one of the things I saw from my perspective and my experience is that the individual would respond to the mother because that's we taught her and she was able to use it. But once the mom is not there and the dad is there or the siblings were there, he completely ignored the visual support and went back to kind of the behaviors, right? So that's another thing. We had to make sure that the parent knew how to let the other members of the family to be involved if I didn't have access to them, because it's not always that I have access to, for example, the fathers or the brothers, so that's where I'm thinking about how we can use this dimension in the training of the visual support. Thanks.
Of course. So generally getting parent involvement in our programs, I'm sure we can all agree it's just a barrier that we sometimes face. But at least when we don't have that, at least when we have parents who are willing to join in and are willing to provide that support, it would be good to have something manualized, to have a specific strategy to go about in order to give them the support that they need. So as we were saying, analytic, being able to show that there is a specific change in behavior. And again, as we said, visual support as an intervention is very analytic in nature, and then we can very easily prove what changes it's doing. But can parents do the same? Are we also taking data for the home? Are we also taking data and analyzing it for the home and for the community? Are we checking if the child is really applying it when he's at the park or when he's at home, or are we not? So there needs to be specific effort put into that dimension. And this is also a big focus on my research, because focusing on sexual health education, it's not enough for me to decrease inappropriate sexual behavior in the clinic setting or in the school setting. It's even more important for me to see it happen everywhere else, across time and across different environments and with different people as well. So this aspect, this dimension needs specific effort. And behavioral, very easy to identify the behaviors that we're working on. When we introduce visual schedules, what's happening to that behavior, we can observe them, we can measure them. Really depends on which type of visual support we're using. So, for example, if we're introducing visual support for the task analysis example that I gave for washing the dishes, we can easily measure how that behavior is shaping up and if it's leading to independence or not, and what type of prompting we're still using, and how that prompt fading is going. But are parents also able to see that change, and are parents also able to really understand its importance? Maybe we can use behavioral skills training for parents. I mean, I'm just putting that idea out there, but maybe we can use behavioral skills training for the use of visual support for parents specifically. So this is the final aspect. So just on a final note, maybe we can talk a little bit more about how we can start that with early intervention. I mean, if we know from the evidence the importance of visual support, maybe we can do it as a as a proactive approach instead of a reactive approach. Maybe we can start it for younger learners as part of an early intervention program. Maybe we can put together our own focus groups, whether it's in a school setting or in a clinic setting or whatever setting you work in, just having these focus groups in which we really ask parents, what's going on? How can we help you? Really looking into parental involvement. because this is what this article did. It did not only rely on the literature. It did not only rely on that review that they did. What they did is that they also did surveys, and from that surveys, they put together focus groups. This is also the strategy that I have adopted for my research. And the amount of information that comes out of these focus groups is really priceless because, I mean, it is very, if you're doing it for a school setting or for a clinic setting, or even if you're doing it on a national level, you know, so parents of a specific country or parents of a specific age group, or it can really be done with different dimensions. But that information is very culturally appropriate, and you're not relying on literature that is done in different environments. You're focusing on where your work matters. So I love the approach of this journal article, and I have really adopted it in my own research. And building bridges, I think this is very important for any type of intervention that we're doing. We might seek out data and seek out, you know, a specific improvement in a behavior, and then sometimes we forget that this needs to be generalized. There's a quote by Faraday when he invented when he was talking about the electrical currents. They asked him, what good is it? And he said, what good is a newborn baby? And this really came to mind when I was reading about this visual support, because someone asks you, I mean, okay, we're doing visual support, what good is it? And there's so much that you can do with it. You just need to put the effort. It's like a newborn baby, you know, it will grow and it will develop, and you will see what good will come out of it once that effort is put in. So it's the same thing with visual support. I mean, it's only as good as you make it. It has a large evidence base. It's just that bridge that really needs to make sure that it is generalized appropriately. And I think this should be it. There is a link for the survey, and I would really love to say in chat if there are any questions, any comments, any experiences that someone would like to share.
Hi, I'll pass this back to Sharifa. This event is scheduled until 6:30, so we do have quite a lot of time to go through each of the dimensions in that. So Sharifa, can I pass it back to you?
Yes. I would like to learn more, Asmahan, about the journal itself, or the article that you chose.
Yes.
Do you mind just going to that slide of your the first slide, if you don't mind? Yeah, this one. So we, you know, I don't know if you were able to highlight the importance. So they talked about the importance of visual support. Can you talk more about what they mention?
It's cut. Sorry.
Okay.
Sorry, it's cut. Can you repeat, please?
Yeah. Can you hear me now?
Yes.
Yeah. I wanted to learn more about what did they mention about the role of parents in the validity of the intervention? What kind of advice did they mention? Have they collected this information from the scope of review that they've done?
So basically what they did is that
we couldn't hear.
It's
they cutting, Asmahan.
Can you hear me now?
Yeah, it's much better. What did you say? Sorry.
I'm saying, so the first part, so here I talk a little bit more about it here. So the first part in the literature, from the literature, they came out with terminologies and the different types of visual supports, how they're used, the different types of studies done. But to get the parental perspective, they relied on the surveys and on the focus groups. I don't know if that answers your question, but from the literature, they dove into the literature that was done on visual supports in the home or community setting. So that included talks about, so it's important maybe to mention here that there were none that were specifically for the home setting. 0 out of these 34 were specifically done for visual support in the home setting. The 34 articles included the home setting just as an extra step for implementing visual support, and the rest, those that were excluded, were for visual supports either specifically in the school or specifically in the clinic setting. So these 34, they were 54, but then they excluded 20 of them. These 34 specifically, they came out with different terminologies, and that helped shape the surveys and the focus groups. This is where the parents were mostly involved, in the surveys and the focus groups. Does that answer your question?
Yes, yes, it actually does. And I'm just thinking, how can we support our families in our region here with regards to using, because the numbers or the percentage that you discussed in this article, I mean, I wouldn't imagine if it's too far from what we are focusing on here in our region. And a lot of the families I was talking about regarding inserting visual support, you know, they still don't feel that it's important. They still feel that, you know, having visuals will prevent him from, you know, accessing or building the other skills. But actually what I saw, and I always give that example, and maybe the others, whoever are in the same field as we are, I always say talking, or, you know, when you're talking to someone, it goes into the environment and it's gone, right? You hear it and it's gone. But imagine if we have something that is always there as a reminder. And I always go back to our examples that we do in our lives, that we depend a lot on visual support. You know, writing down your task list of things, that to-do list of the day, you know, your calendars, they are all under the umbrella of visual support. So why do parents need to give that excuse of, oh, it might delay, while we actually apply it in our everyday life, even in the environments, in the airports, in restaurants, in, you know, even in the malls, or giving directions in the streets. We see that every day in our lives. And so the only thing that I think that might be of concern for the families is, one, that it might delay other skills. Two, I don't have time to create those visual supports. Three, when do I use it? How do I use it? You know, I think it's also important for us as professionals to look at these kind of things. And the family dynamic, who is going to be using the visual support?
Yes. I mean, this is very important what you're talking about, because this is where the really culturally appropriate, individualized interventions come up. Because some families, again, I mean, nothing here was mentioned about it not being or it being a barrier to learning. I mean, this was done. This was not done in the UAE. This was not done in Lebanon. This wasn't. So this is not specific to where I work as a professional. But maybe if I did the same study on my population, I would find that, as you're saying, one of the barriers are, you know, I don't want it to hinder expressive language. So this was not mentioned in this article, but it might be one of the results that I get. So that's why I think it's very important for us to really look into what our specific issues are, why our parents, and really that differs from family to family. I mean, the focus group that they put together is smaller than the survey that they sent out. But I think focus groups are just really asking individual families, what is your specific concern? What is your specific issue? Where do you feel you need it? I wouldn't go and put visual support where it's not needed at all. If the child has an excellent memory and can memorize his schedule and does not have a problem with transition, then the family would probably not see the importance of it. But if the child is having problem transitioning from playtime to shower time, from shower time to dinner time, then I think that would really help support the reason why we need to implement this visual schedule, for example. So coming in where it's needed and really providing that parent with the rationale behind its implementation, and asking parents specifically, what do you need and how can I help you? You know, some parents are very scientific minded. If you share with them enough research, enough evidence, they're good to go. Some parents won't really look at that. They want more. They have different concerns. They have concerns about the ease of use. So it really depends from family to family and from group to group. So it would really be interesting for us to really ask our families and ask our parents, what is your specific issue and how can I help you with that? So yeah, yes, so if anyone else would like to share something, I think Sarah is.
Yeah, can you hear me all right?
Yeah. Yes,
okay.
We can.
Hang on one second, my computer was just lagging.
Hi.
I guess a discussion point, not really a question for you specifically, but for everyone. You know, I've also seen in clinical practice, as well as kind of going into consulting situations, or you know, just being around schools and clinics and things like that, I've seen a lot of examples of incorrect and bad and problematic uses of visual schedules, in terms of, you know, sometimes you go in and the whole wall is kind of wallpapered in you know, board maker pictures. So what are people's thoughts on how we can make sure that when any sort of visual supports are being used, they're being used for a purpose that has an evidence-based rationale, and how do we help I guess the people kind of on the front who are going to be implementing determine, okay, this is a time when, you know, due to the lack of stimulus control in this situation, we really should be implementing a visual prompt in this case, or this is a case where that actually would be distracting and actually would kind of decrease the intervention we're trying to put in. Does that question make sense?
Yes, definitely.
Yeah. I'm just curious what people think about that.
Yes, I would love to hear different takes on this. For me, I think that brings back the dimension of the analytic perspective of it, really knowing what we're targeting, what behavior are you targeting with this visual support, why is it there, and what is it doing, and is it effective, is it working on really teaching that skill, or, you know, leading to less I don't know, prompting, or, you know. So that really brings back this dimension, this question. Someone else would like to share their experience with, you know, the overuse of visual support where it's not needed or it's distracting. I've seen a lot of that. But really, maybe as behavioral therapists, we need to focus on making sure it is valid as an intervention and serving a specific purpose.
I want to add to that, actually, because I get a lot of that where professionals would just say, just add pictures in the toilet, you know, just add those visuals, you know, the sequence of the toileting sequencing. A lot of these special eds, they would just refer the parents into, just put those visuals. It will help him to remind him. My question is, the fact that you merely just put the visual on the bathroom wall just because he has specific label does not justify that you know, that the kid needs it. And so far that will make him dependent on those visual support. And we've seen those problems where the kid changes a different bathroom, he goes to the bathroom in the mall, and the visuals are not there, and the parent needs to do everything for him again. And all of this training that they've been working on just goes down the drain, you know. So yes, I totally agree that we have the responsibility to, you know, let the parents be aware that maybe those kind of schedules might need to be faded out if the child needs to fade out this support or the visual support, you know. And part of our prompting procedure in the behavior analysis is visual support, you know, visual prompting, and how to fade it out. Now, a lot of families that did use and fell into that trap where the child got into this problem where he needs to look into the step of washing hands, he looks at step 3 and then goes to step 3, and it just keeps going that way. So what happened, a lot of the parents, what they did, we kind of had to, you know, remove it and then gradually delay the prompt being in front of him. So that was one of the things that we were able to do. to help that kid to be less dependent on those visuals. Because at the end of the day, he knew the steps. He just needed that, checking.
Yeah, he needs
You know,
to check to make sure that he's getting it right. So that's something that we've seen a lot with visual schedules, and even with different types. So even with the timers, you see that sometimes they. Personally, my rule of thumb is if he or she can eventually do it independently, can put together that visual. So with, for example, with choice boards, it sometimes get to a point where you can teach the child to put together their own options independently, and then use that as, kind of like a visual support. For timers, you can teach a child, and we've taught children very often to set their own timers if they feel better seeing those 5 minutes instead of hearing it. So as long as you can teach for independence in the use of these visual supports, then you're good to go. Otherwise, then we would definitely work on fading it out or on turning it to a different type of support if that's possible, because for some children they would still need that support, especially if you're teaching it, which is why I mentioned the importance of early intervention, because if you're introducing it for an adolescent, it's different than if you're introducing it for a child. For an adolescent, you might have different priorities for the program. You'll just keep the visual support there as long as it's getting the independence that you want. So that's really, that changes from case to case. And I've worked with those where, we just keep the visual support there because we're prioritizing something else. And with those where we're trying to teach independence from those visual supports. But with some cases, why not teach them to implement the visual support alone? So yeah, I think it just depends on the case that you have and how you can individualize that.
Another question, maybe that kind of sparked the conversation, with our participants that are with us today. The choice of pictures. Has it been mentioned, the choice of pictures, anywhere in the article? If not, what do you think about that?
No, they just mentioned that they're including all different types of pictures. They did not mention anything
whether it's cartoon or real life pictures.
They mentioned that they're including all different types of visual supports, but they did not specify anything. It wasn't one of the criteria.
Yeah, I get that question a lot. I get that question. Should I use cartoons, or should I use himself doing the skill and take photos of that, or someone else doing it, or a real picture of his real toy or his real bed, or just a genre picture of a bed? I don't know if what have they used and what do they think?
Anyone would like to share their experience with that? Personally, I've used both. Depends on the learners that we have. I would always prefer using generic pictures that are not specific to anything, because it's easier for you to generalize, right? But for some learners, we want faster results, or it's not that easy for them to generalize it, so we go for specific pictures. Anyone would like to share what they've used? Yeah, it depends on the learners. I think so too.
Hi, so I just wanted to bring everyone's attention to a couple of links that I've just posted in the chat, if that's okay, Asma. So yes, I've given a link for an evaluation survey. As always, we really appreciate your feedback on these sessions. So please use this opportunity to tell us what you loved about this evening's session and any suggestions for change. I've also given you a link for the board BACB certificates in the audience. So given that we're finishing up a little bit earlier than we had planned, you will get access to one BACB CEU. So the link is there. So you just need to enter those 2 code words that Asma shared with you. And as always, please, if this is your first time applying, please do check your spam folder, and please do ensure that you enter your email address correctly, and it will pop to you straight away, I promise you. And I've also given you a link to register for the ABA Journal Club as well. So for those of you interested in registering for future events, please do feel free to follow that link. Thanks, Sharifa, and thanks, Asma. Back over to you, Sharifa.
Thanks, Michelle. Is the link, sorry, because I don't know why I'm not getting it in my chat. All I see is the links that I've put in the chat.
I can see the link to register for the ABA Journal Club that was sent.
Do you have that link for the CEU, Michelle? Because I'm just always recorded sessions are here.
I posted them and I've just reposted them again.
I don't know why I'm not. I can hear the message tling, but I'm not seeing it on the chat. I don't know why. I might just need to refresh that. So are we then gonna end at what time for us to get one CEU?
Yeah, where we fulfilled the criteria for one CEU, which is 50 minutes.
Already.
Thank you, Sharifa.
Great, thank you so much. Wonderful. So so that means I need to wrap up. Okay, so again, I want to thank Asmahan for this amazing discussion and this amazing choice of article, because it is indeed something that is practical in our everyday practice. Yeah, and it's interesting to see the challenges that the parents were facing, something that we can learn in our practice. At least we can avoid them and help the families to utilize them in the right way, in the correct way. Asmahan, also please feel free to share those links of the visual support, any apps that you think that the families will use, and the practitioners, of course, because we have a mix of audience today, mashallah. So also I want to thank everyone that is here. Don't forget to join our ABA Journal Club Instagram account. I will be posting, or we will be posting, any other new upcoming talks. Our next talk will be in 3 months, so in the next so yeah, end of September probably, or something like that. We will keep you posted. And of course, don't forget to evaluate today's lecture. We want to learn more and how to make it better, as usual. And thank you so much. I really appreciate it.
Thank you for
Thanks
everyone.
again for Dr. Michelle.
And Dr. Kelly. Thank you, everybody. Really appreciate it.
Thanks, Dr. Michelle, for supporting us as usual.
You're most welcome. Thanks, Asma. Thanks, Sharifa. Stay safe, everyone, and see you at our next ACE event. Thank you all.
Bye.